Most of us are taught from a young age that more testing equals better health. After all, the logic seems straightforward. The earlier you detect a problem, the better your chances of fixing it. And once we pass 65, many of us assume that every blood test on the list is essential, almost like an insurance policy against hidden diseases. But what if that isn't entirely true? What if some of the routine blood tests seniors are still given are not only unnecessary, but may actually drain your finances, cause needless worry, and even lead to harmful interventions? That might sound surprising, even unsettling, but it's a truth more and more doctors are acknowledging. Not all blood tests are created equal. While some remain essential for monitoring chronic conditions and catching real risks early, others provide very little value once you reach a certain age. And in some cases, those numbers on a lab report can do more harm than good, especially if they lead to a chain of treatments you didn't really need. This video isn't about skipping important checkups or ignoring your health. It's about separating fact from habit, understanding which blood tests still serve you after 65, and which ones may be costing you peace of mind, energy, and money without delivering meaningful benefits. So stay with us as we go through 7 common blood tests that doctors may still order for seniors, but that medical experts say often don't provide the benefits you think. Test number 1. Routine vitamin D. Test for years, vitamin D has been marketed as the miracle vitamin. It's been linked to everything from strong bones and improved immunity to a reduced risk of cancer, heart disease, and even depression. Because of this reputation, testing vitamin D levels became a standard part of routine checkups, especially for older adults. Doctors began ordering the test almost automatically, and many seniors came to believe that tracking this single number was essential for protecting their long-term health. But here's the surprising reality. For the vast majority of healthy people over 65, routine vitamin D testing doesn't actually translate into better outcomes. In fact, in recent years, multiple studies and expert panels, including the U.S. Preventive Services Task Force, have concluded that widespread testing is unnecessary for most older adults. The problem starts with the way normal vitamin D is defined. Lab standards differ dramatically. What one lab flags as insufficient might be considered completely normal somewhere else. This inconsistency can cause confusion, anxiety, and most importantly, overtreatment. When test results suggest low vitamin D, many doctors prescribe high-dose supplements right away. But too much vitamin D can be just as harmful as too little. Excessive supplementation can lead to nausea, constipation, kidney stones, kidney damage, and even dangerous calcium imbalances in the blood, a condition called hypercalcemia. And because the symptoms of vitamin D toxicity often appear slowly, patients don't always connect their new health issues back to the pills they were prescribed. Consider the case of Linda, a 70-year-old who had her levels checked during a routine exam. Her doctor told her the number was slightly low and immediately prescribed high-dose vitamin D capsules. Within months, Linda was dealing with recurrent kidney stones and severe abdominal pain. Eventually, another physician reviewed her chart and explained that her original vitamin D level was actually appropriate for her age and that she had been supplementing far beyond what her body needed. In her case, the test not only failed to help her, it actively harmed her health. The smarter approach is more measured. For most older adults, regular safe sun exposure and a balanced diet with foods like salmon, eggs, or fortified dairy provide sufficient vitamin D. Testing should be reserved for people with specific medical conditions, such as osteoporosis, certain bone disorders, malabsorption syndromes, or long-term use of medications like steroids that affect vitamin metabolism. In other words, vitamin D testing is not harmful in itself, but using it indiscriminately on every healthy senior often creates more problems than it solves. By focusing on lifestyle, diet, and only testing when there's a medical reason, older adults can avoid unnecessary anxiety, overtreatment, and side effects. Test number 2. Routine iron studies, ferritin and iron levels. Iron deficiency anemia is a real medical condition, and in certain cases it requires careful attention. But once you reach your mid-60s and beyond, the value of routine iron studies, tests like ferritin, transferrin saturation, and serum iron, becomes far less clear. In fact, for most older adults without symptoms, these tests can be unnecessary, misleading, and even harmful. The problem lies in how iron markers behave in the body. Ferritin, the protein that stores iron, is often used as the main indicator of iron levels. But ferritin is what doctors call an acute phase reactant, which means it goes up not just when you have extra iron, but also whenever your body is fighting off inflammation, infection, or chronic illnesses. And since many seniors live with conditions like arthritis, diabetes, or low-level infections, ferritin levels can appear abnormally high even when iron stores are perfectly normal. On the flip side, mild, low readings can push physicians to prescribe iron pills or even intravenous iron infusions, even though the body may not need them. That's where the risks begin. Excess iron is not easily flushed out of the system. Instead, it gets stored in vital organs like the liver, pancreas, and heart. Over time, these iron deposits can contribute to organ damage, worsening heart disease, liver problems, or metabolic disorders. What started as a well-intentioned routine test can set off a chain reaction. Abnormal lab results, unnecessary treatments, and added health risks. Even more concerning, false or ambiguous results from routine iron tests often spark a cascade of further investigations. Doctors, concerned about potential hidden sources of blood loss, may order colonoscopies, endoscopies, or CT scans. While these procedures can be life-saving when symptoms point to a real problem, they also carry their own dangers when performed unnecessarily. Sedation risks, bleeding, infections, or, in rare cases, serious complications. Take Robert, a 73-year-old who underwent iron studies at his annual checkup despite having no symptoms. His ferritin came back slightly abnormal. Worried about possible internal bleeding, his medical team recommended a colonoscopy. Unfortunately, during the procedure, he suffered a bowel perforation, a serious complication that required hospitalization and weeks of recovery. In the end, further review showed his ferritin wasn't signaling iron deficiency at all, but was simply elevated due to mild, age-related inflammation. Robert endured pain, stress, and medical bills for a problem that didn't exist. The smarter approach is to reserve iron studies for situations where they're most useful, when symptoms clearly suggest anemia. If a patient is experiencing persistent fatigue, weakness, pale skin, shortness of breath, or unexplained dizziness, testing iron levels can provide valuable answers and guide treatment. But in otherwise healthy seniors without symptoms, routine iron checks rarely change outcomes. Instead, they can create confusion, trigger unnecessary interventions, and even put patients at risk. For older adults, the key is not to test every possible number, but to test with purpose. Iron studies should be symptom-driven and medically justified, not reflexively added to annual blood work. By using these tests more selectively, seniors can avoid the spiral of overdiagnosis and overtreatment, and focus instead on the markers that truly matter for their health. Test number 3. Routine thyroid tests, TSH and T4. Thyroid function tests are among the most common blood draws ordered during annual checkups for older adults. Doctors often check levels of TSH, or thyroid-stimulating hormone, alongside other routine labs, even if there are no clear symptoms. On the surface, this seems like a sensible way to catch thyroid problems early. After all, thyroid disorders are real, and untreated cases can lead to fatigue, weight changes, and heart issues. But when it comes to seniors, automatic thyroid testing often causes more confusion than clarity. The reason is simple. Thyroid hormone levels naturally shift with age. In particular, TSH, the primary marker used to evaluate thyroid function, tends to rise gradually in older adults without necessarily indicating disease. A number that would raise concern in a younger patient may be perfectly normal in someone over 70. Unfortunately, many seniors are labeled with hypothyroidism based solely on these mild shifts. Once that diagnosis is made, they are often started on lifelong thyroid medication, even when their thyroid is functioning well enough for their body's needs. This matters because treatment is not risk-free. Large clinical studies have shown that treating mild or subclinical thyroid abnormalities in people over 65 rarely improves energy, mood, cardiovascular outcomes, or life expectancy. In fact, unnecessary thyroid hormone therapy can sometimes make things worse. Over-replacement of thyroid hormone may push the body into a hyperthyroid state, increasing the risk of irregular heart rhythms like atrial fibrillation, accelerating bone loss that leads to fractures, and contributing to anxiety or sleep disturbances. What was intended as a preventive measure can end up reducing quality of life. Emily, a 76-year-old retiree, experienced this firsthand. At a routine visit, her doctor noted her TSH was slightly elevated and prescribed thyroid hormone. Within months, Emily began experiencing racing heartbeats, restlessness, and chronic insomnia. Concerned, she sought out an endocrinologist for a second opinion. After reviewing her full lab history, the specialist explained that her thyroid levels were completely appropriate for her age group, and that she never needed treatment in the first place. The very medication meant to fix her numbers had created new health problems. Emily's case is far from unique. Across the country, thousands of older adults are put on thyroid medication unnecessarily each year, often without clear symptoms of disease. Once started, these prescriptions are rarely reevaluated, leaving patients locked into long-term treatment plans they may not benefit from. This is a classic example of overdiagnosis, finding and treating a condition that, in reality, isn't harmful. The smarter approach is more selective. Thyroid testing can be incredibly valuable when symptoms point toward a problem. Unexplained weight gain or loss, persistent fatigue, changes in bowel habits, hair loss, swelling in the neck, or heart rhythm abnormalities. In those situations, blood tests help confirm a diagnosis and guide treatment. But blanket screening in otherwise healthy seniors with no signs of thyroid disease rarely provides useful information. Instead, it risks creating unnecessary worry, costly prescriptions, and dangerous side effects. By focusing on symptoms rather than automatic numbers, doctors and patients can use thyroid testing more wisely. For most seniors, the goal isn't to chase perfect lab results, but to support overall health and well-being. Sometimes the best medicine is recognizing that not every small lab variation needs fixing. Test number 4. Routine tumor marker blood tests. Few words carry as much emotional weight or as much fear as cancer. For seniors in particular, the idea of catching cancer early feels like a matter of life and death. It's no surprise, then, that many older adults assume more testing must always be better. In response to this anxiety, some doctors still order blood tests for so-called tumor markers, proteins that were once thought to reveal hidden cancers like ovarian, pancreatic, or liver cancer. At first glance, this seems like an appealing safety net, but in practice, tumor marker tests are notoriously unreliable when used for screening. The problem is that tumor markers are not cancer-specific. These proteins can rise for countless reasons, many of which have nothing to do with cancer at all. Everyday infections, minor inflammation, liver disease, kidney problems, or even the normal biological changes of aging can all cause false positive results. That means perfectly healthy seniors may be told their results look suspicious, launching them into a whirlwind of anxiety and follow-up testing. And once that alarm bell has been rung, it's very difficult to ignore. When abnormal tumor marker results appear, doctors often feel pressured to rule out cancer, which usually means ordering additional imaging like CT scans, MRIs, or ultrasounds. In some cases, it even leads to invasive procedures such as biopsies or exploratory surgeries. All too often, these aggressive steps confirm there was never a cancer to begin with. But by that point, the patient has endured weeks or months of worry, exposure to radiation, the risks of anesthesia, or the side effects of procedures that were never truly necessary. Henry, a 75-year-old retiree, experienced this spiral firsthand. During a routine annual blood panel, his doctor added a tumor marker test just to be safe. When the results came back slightly elevated, Henry was told pancreatic cancer was a possibility. The fear was immediate and overwhelming. Over the next several months, he underwent repeated CT scans, blood draws, and eventually an invasive biopsy. The stress consumed his daily life. He barely slept, lost weight from worry, and spent countless hours shuttling between medical appointments. Finally, the biopsy confirmed what his body had been telling him all along. He never had cancer. The test had simply been a false alarm, but the ordeal left him exhausted, shaken, and mistrustful of future medical care. Henry's story illustrates why experts across the medical community strongly discourage the use of tumor marker tests for routine cancer screening. Leading organizations, including the American Society of Clinical Oncology, agree that these tests have no place in evaluating otherwise healthy seniors. Instead, their value lies in monitoring patients who already have a confirmed cancer diagnosis, helping doctors track whether treatment is working or whether the disease is returning. In that context, tumor markers can be useful, but as a broad screening tool for the general population, they do more harm than good. For seniors, the smarter approach is to focus on evidence-based cancer screenings like mammograms, colonoscopies, or low-dose CT scans in certain high-risk smokers, rather than relying on unproven blood tests. It's not about ignoring cancer risk, but about avoiding the false promises of shortcuts that don't deliver. When it comes to tumor markers, more testing is not the same as better care. In fact, for healthy older adults, the safest choice is often to skip the test altogether. Test number 5, routine ESR and CRP tests, inflammation markers. Erythrocyte sedimentation rate, ESR, and C-reactive protein, CRP, are two common blood tests that measure inflammation in the body. At first glance, they seem like useful tools. After all, inflammation plays a role in everything from arthritis to infections to heart disease. Many doctors still order ESR and CRP as part of annual panels, believing these numbers provide a kind of window into hidden disease. But the truth is more complicated. These tests are nonspecific. That means they can rise in response to almost anything, something as minor as a cold, a flare of joint pain, or even a bruise. For seniors, the challenge is even greater. As we age, baseline levels of inflammation in the body naturally increase. This process, sometimes called inflammaging, means that slightly elevated ESR or CRP levels are extremely common in people over 65, even when there's no disease present. What looks abnormal on paper may in fact be perfectly normal for an older adult. Yet once these results come back flagged, the reflex is often to dig deeper. Doctors, concerned about what could be hiding beneath the surface, may order expensive imaging scans, send patients to multiple specialists, or prescribe medications that are not truly necessary. The ripple effects can be significant. Abnormal ESR or CRP results often spark what's known as a diagnostic cascade. A simple, harmless elevation sets off a chain of follow-up appointments, repeated blood draws, ultrasounds, CT scans, or MRIs, all in the hunt for an illness that may not exist. Each new test adds cost, stress, and sometimes even exposure to risks like radiation or invasive procedures. For seniors already managing multiple health concerns, this cycle can be exhausting and overwhelming. Mary, a 71-year-old retiree, knows this experience all too well. During her routine annual physical, her blood work showed a mildly elevated CRP. Concerned about possible hidden inflammation, her primary care doctor referred her to a rheumatologist. Over the next several months, Mary underwent a battery of tests: X-rays, ultrasounds, repeated blood work, searching for autoimmune diseases like rheumatoid arthritis or lupus. She missed social events, worried endlessly about her health, and faced mounting medical bills. In the end, no disease was ever found. Her slightly high CRP was nothing more than a normal, age-related shift, but the ordeal left her shaken and less confident in the medical system. Stories like Mary's highlight why experts caution against using ESR and CRP as blanket screening tools for healthy older adults. These tests are not useless. They can be incredibly valuable when a doctor suspects something specific. For example, they're helpful in tracking the severity of rheumatoid arthritis, monitoring infections, or ruling out inflammatory conditions when symptoms are present. In those cases, rising or falling numbers can guide treatment. When ordered in the absence of symptoms, they rarely provide clarity, and far too often they generate confusion instead. The better approach is targeted testing. Rather than including ESR or CRP in every annual panel, doctors should reserve them for situations where clinical signs point toward a problem. For most seniors, chasing every minor fluctuation in these nonspecific markers leads not to peace of mind, but to unnecessary procedures and worry. The smarter path is to let symptoms guide decisions, not just numbers on a lab report. Test number 6, routine vitamin B12. Testing vitamin B12 is an essential nutrient for healthy nerves, red blood cell production, and brain function. Because deficiencies can cause symptoms like fatigue, numbness, or memory problems, many doctors add B12 levels to annual lab panels for seniors. On the surface, this seems like a reasonable precaution. After all, who wouldn't want to catch a deficiency early? But the reality is more nuanced. In older adults, B12 levels on standard blood tests can be highly misleading. That's because the test measures the total amount of B12 circulating in the blood, but not how much of it is actually usable by the body. Some seniors may appear deficient on paper, yet show no symptoms and function perfectly well. Others may have normal numbers, but still struggle with nerve issues or fatigue because their bodies cannot properly process B12. This leads to two common problems: overdiagnosis and underdiagnosis. On one hand, seniors with mildly low results may be prescribed lifelong B12 injections or supplements they don't really need. On the other, truly deficient patients may be missed because their numbers still fall within a so-called normal range. To complicate things further, B12 can be influenced by other factors common in older adults, like certain medications, alcohol use, or digestive conditions, making results even harder to interpret. Consider James, a 69-year-old retiree who was told during a routine screening that his B12 was slightly low. His doctor immediately prescribed monthly B12 injections, which continued for years. But James never had symptoms, and later a specialist explained that his levels were perfectly safe for his age. He had spent years undergoing unnecessary treatments that caused more anxiety than benefit. The smarter approach is to order B12 tests only when there are clear symptoms, such as unexplained fatigue, memory decline, or numbness in the hands and feet. In those situations, B12 testing can be a critical diagnostic tool. But as a blanket check in healthy seniors, it often adds more confusion than clarity. Test number 7. Routine kidney function panels, creatinine and eGFR. Another set of labs often included in routine blood work for seniors are kidney function tests, such as serum creatinine and estimated glomerular filtration rate, eGFR. These numbers are meant to measure how well the kidneys are filtering waste from the blood. Because kidney disease is a legitimate concern in aging populations, many doctors test them annually, even for patients with no risk factors or symptoms. But here's the catch: kidney function naturally changes with age. It's normal for a GFR to decline slowly over time, even in perfectly healthy seniors with no underlying disease. What looks abnormal in a 35-year-old may be entirely expected in a 75-year-old. Unfortunately, many older adults are labeled as having chronic kidney disease, based solely on these age-related shifts, even when their kidneys are functioning adequately for their stage of life. The consequences of this can be significant. Once that diagnosis appears in a medical record, it can affect everything from insurance coverage to treatment decisions for unrelated conditions. Seniors may be told to avoid medications, undergo frequent monitoring, or see a nephrologist, all based on numbers that reflect normal aging rather than true disease. Take Margaret, age 74, who was shocked to learn her eGFR suggested stage 3 chronic kidney disease. Panicked, she began seeing a kidney specialist, underwent repeated ultrasounds, and dramatically altered her diet. Months later, her specialist reassured her that her results were completely typical for her age and did not indicate progressive disease. The stress, lifestyle changes, and medical bills had been unnecessary. The smarter approach is context. Kidney function tests are valuable for seniors with diabetes, high blood pressure, or other known risk factors, and they are essential when symptoms like swelling, fatigue, or changes in urination appear. But as a blanket annual screen for every senior, these tests often pause and create more fear than benefit. For most older adults, the focus should be on trends, how kidney function changes over time, rather than a single number taken out of context. Smarter healthcare, not more healthcare. Reaching 65 and beyond should mean focusing on quality of life, not endless lab work. Yet too often, routine blood tests are ordered simply out of habit. The problem isn't that these tests are dangerous by themselves. It's the domino effect they set off. False alarms, unnecessary treatments, emotional stress, and wasted money. Good medicine is not about testing everything. It's about testing wisely. Seniors should focus on proven blood tests that guide real treatment decisions. Things like blood sugar for diabetes, cholesterol for heart health, and kidney function for medication safety. Beyond that, testing should be driven by symptoms, not by routine. The next time your doctor suggests a long list of blood tests, pause and ask, how will this test improve my health? Will it change my care or just give me a number? That simple question can save you from unnecessary worry and keep your healthcare focused on what truly matters. Because at the end of the day, the best healthcare for seniors isn't about doing more. It's about doing what counts.